So I'm noticing on my social media feed about a new release from the American Society of Clinical Oncology, ASCO, on a recent study called the Challenge Trial, where they were looking at structured exercise and colorectal cancer stage, I think 2, 3. And what did they notice? They noticed people living longer, um, reducing the risk of death, and less cancer reoccurrence. Um, so, all these great things from this simple tool. And just to provide some historic context, is that when I first started helping people with cancer over 20 years ago, if you recommended exercise to people, it was always like, there's no research in it, there's no evidence, you're wasting your time with it. And groups of us, and me included, received our share of lashings on our back. I got a few scars. So it's wonderful to actually see and hear this, the excitement of oncologists that I've been following. But 20 years later, in a prospective trial, and these are patients who finished their chemotherapy and then just did a structured exercise. So I'm not exactly sure what that entails, but and what's also is really kind of refreshing to see in some of the oncologists is like, oh, like here, when you look at these outcomes, when you compare it to some of the drug trials that are being discussed, this is looking way better than a bunch of those. And yet with these drugs, are talking about practice changing. Like one of them, I think it was called the Atomic trial, that one oncologist was talking about, was adding in a new immunotherapy drug. Well, guess what that cost of that one drug is? Like $10,000 a shot. So when is our systems, like here in British Columbia, our provincial and federal systems, going to actually really provide a framework where people can actually do these things, get supported from it? How's about like giving them incentives? How's about giving like free gym memberships? How's about club memberships? How's about writing all these things off in taxes? How's about like paying for structured programs? Like, they're pretty easy to pay for really expensive drugs and protocols that can cost you over $100,000 a year. And yet for exercise, they'll just say, we'll do more exercise, but there's got to be a structured framework that people can do this. You accommodate it to the individual people. And guess what else you're going to notice? Unlike the drugs, it's like, yes, they can be helpful, but there's side effects. Well, what would be the side effect of exercise generally? Well, let's see, your blood pressure, if it's high, can get better. Your mental health could improve. If you have inflammatory things, you could feel better from it. So it's all these great things, but I think now is time where government needs to like provide like incentive structure, get people motivated, get them excited to implement these things. And so anyways, you'll hear a lot more of this, I'm sure, in the news, but it's wonderful to hear. But just remember, the concept of exercise is not new, but it's taken the system, conventional medicine, like a long time to finally put some strong data or stronger data in this subject. I'm sure more to come.